Good morning, good day, or good evening, wherever you are. Today we are hosting episode 3 of the APAGE ISMIVS HIFU session or forum. I'm a chairperson, and assisting me, before that, just to read, we are in the 9th, today, the third session, 9th of July. Assisting me, my co-chair is Dr. Yuen Pong, a very good friend of mine. Pong, myself, and Professor Lee Chi-Lung met in year 2000 in Singapore, and we just sat down and mooted this idea of forming an association so that Asians can present their work and the research on an international platform. I think so far we have been doing well, and it's growing in size, in numbers, and in interest. So Pong will be my co-chair. Share a little about Pong. He's currently the director of minimally invasive gynecology at Hong Kong Sanitarium and Hospital in Hong Kong. He's also the honorary consultant of the hospital and honorary clinical associate professor of the Chinese University of Hong Kong and University of Hong Kong. He was a consultant and head of gynecological endoscopy in Department of ONG, Prince of Wales Hospital from 1997 to 2007. He was also the founding member and past president of the Hong Kong Gynecology Endoscopy Society and the Asia Pacific Association of Gynae Endoscopy, which is APAGE. So he's actually a past president of APAGE. Without further ado, I will hand you over to Pong, who will introduce our next expert panelist, Dr. Gopinath. Over to you.
Yeah, welcome to the P.M.Gopinath, this expert panelist today. Dr. Gopinath is the director and senior consultant of the Institute of OBG and IVF, SRM Institute of Medical Science in Chennai, India. He is currently the Vice President of Fertility Preservation Society of India. He is also the member of International Fertility Preservation Society, the Chairman Board of Studies, TNDR MGR Medical University. He was awarded the leading lights in the field of reproductive medicine in Fertility Vision 2018. He has published many international and national publications. His special interest is in infertility, laparoscopy, hysteroscopy, and preservation of the fertility. Welcome to the Gopinath.
Thank you.
In this series of webinars, I'm also choosing a selection of very skilled surgeons so that every one of you can brainstorm with them, pick their brains on their skills, their thoughts, and modification of HIFU protocols to suit the practice. So now, just to remind everybody, the series covers HIFU, high intensity focused ultrasound. In China, they call it FUAS, which is focused ultrasound ablation surgery. So they're interchangeable. This is the machine we're talking about, HIFU, which is, I call it the virtual knife. And the knife, the ultrasound knife actually comes out from the bottom of this bowl, and the patient lies on top of this machine. And this is brought to you by two organizations, APAGE and ISMIVS. APAGE stands for Asia Pacific Association of Minimally Invasive Therapy and is founded in 2003. Let's take a walk down memory lane. Picture of the APAGE members in 2003. I think you know most of them. That's Professor Lee Chi-Lung, Harry Rich, President-elect Prashan, and the very young Dr. Yuen is behind with all the other delegates from Korea and Japan. This is Pong giving me a memento in the APAGE Hong Kong in 2005. And this is a picture of Professor Felix Wong and myself receiving the Lifetime Achievement Award in Japan, Okayama in 2017. And I'm very happy to say a Lifetime Achievement Award given by APAGE is not a retirement award. I dug up this, was very casual drinks with, in year 2000 with Felix Wong, myself, Hayashi, and I can't remember his name, but this is Pong. And one of these reasons why I want to host this is to introduce our very expert Asians in the world of laparoscopy or hysteroscopy. And not many people know Hayashi actually Professor Lin Baoliang. He works in Kawasaki. And right now, and I still believe, just in 1985, he has done 22,000 flexible hysteroscopy. And the last count in June, last month, 2020, I think he has probably done the most in the world. He has done 6,990 resectoscopies, operative resectoscopies. So I think this man needs mention because he's a very quiet person working in Kawasaki, Japan. And if you come across things like Lin's forceps, Lin's instruments in hysteroscopy, this is the man. And you should actually, you have a chance, watch how he operates, how he does his hysteroscopic surgery. That is Professor Lin Baoliang or Hayashi. This is a picture taken recently in 2019. Again, myself, Pong Mo, Professor Li Qidong, and this is a very, very great teacher in sort of a military uniform. He's actually Professor Lang Jinghe, the chairman of KOGA, and he has a membership of 160,000. He's past president of APAGE also. He's a great teacher, a painter, and you should listen to his lectures, philosopher, his ideology. And if I have my wish, I would love to translate his lecture on adenomyosis from Mandarin to English for you. It is the new treatment of how his view of adenomyosis began to what it is today. That is Professor Lang Jinghe. This is Professor David Cranston. He's a surgeon, but he's instrumental in getting HIFU into the books of NICE, NICE, to be accepted as a mode of surgery for fibroids. We must thank him for this. And this is his group of advisors, a very huge group. Picture taken in 2017. I know I've introduced all these members to you before, but he's going to speak later on. This is their biennial meetings, and when they have a meeting, it's in the thousands. And what's important to note is in July 12 to 14, 2019, APAGE and ISMIVS signed an MOU with regards to HIFU training, education, research, and most important is certification. This is important because HIFU is really very skill-based, although you're looking at the machine, but it is really, really, really skill-based. And I think certification is very important. Recap, there are two different versions of therapeutic HIFU for benign uterine tumors. One is MRI guided. If you go on the website or search, you'll probably be diverted to the MRI guided HIFU, but please take a note and look for the ultrasound guided HIFU, which is more ablative. Why? Because the procedure can be done by gynecologist, surgeon, or radiologist, or any trained doctor. The duration of ultrasound HIFU is independent of the MRI machine, so your MRI can be put to better use.